Thank you for joining us for the 47th Annual AAKP National Patient Meeting. My name is Jim Myers, better known throughout the kidney community as Uncle Jim. I am an AAKP Board of Director and an AAKP Ambassador for the state of Indiana. Polycystic kidney disease, known as PKD, runs in my family. I've lost 5 members of my family to PKD, including my father. I myself have PKD. However, I consider myself fortunate because of my family's history. I was diagnosed at the age of 25, was able to put off dialysis until the age of 58. I was on dialysis for 4 years and transplanted on April 27, 2016. As a full-time kidney advocate, my specialty is my ability to utilize social media to help fellow kidney patients and to raise awareness of the plight of the kidney patient. I am an administrator for over 80 pages on Facebook, another 100 groups on Facebook on various topics, 10 blog pages, and 9 e-newspapers. I have won several professional awards and honors, including the inaugural National Social Media Education and Advocacy Award from the AAKP, and also helped to launch the AAKP's Pediatric Kidney Pals initiative. As an individual diagnosed with kidney disease at a young age, it is imperative that we fight for early disease detection and the appropriate diagnosis of rare genetic conditions that may lead to kidney disease. It is also critical that as patients, we raise our voice and become the leader of our own healthcare team to demand access to the latest innovations in treatment options and devices that are available, and to ensure true shared decision-making starts and ends with us, the patient. That's why I'm so pleased to moderate today's session on staying healthy with kidney disease, so others can hopefully experience what I've experienced by doing whatever is possible to slow the progression of their disease and to put off the need for a kidney replacement therapy such as dialysis or kidney transplantation as much as possible. Today we have with us a friend of mine, the AAKP's Dr. Stephen Fadem. Dr. Fadem is a clinical professor of medicine in the section of nephrology at Baylor College. He is also chair of the AAKP's Medical Advisory Board. As a champion for chronic disease education, Dr. Fadem was one of the first doctors to discover the value of the internet for patient education and founded several websites dedicated to public service and the dissemination of clinical information, including the Nephron Information Center, WikiKidney, TouchCalc, and dialysisunits.com. Dr. Fadem is the recipient of the National Kidney Foundation's Distinguished Service Award, the AAKP Dr. Peter Ludden Award, and the AAKP Medal of Excellence. He is listed in America's Top Doctors and serves as historian for the AAKP. We are honored to have Dr. Fadem join us. I will turn it over to you.
My name is Steve Fadem, and I'm a nephrologist. I'm chairman of the Medical Advisory Board for American Association of Kidney Patients. Today's first presentation is on staying healthy with kidney disease. This is the basis of a book that I just published with Springer. So I would like to go through the highlights of this book and also discuss things that you will want to know about how you can stay healthy with kidney disease. So the big question is, why write a book like this? And this is the table of contents of my talk. Why write the book? Why isn't there more awareness? What is the filter? What are the 3 causes of kidney disease? And we'll talk about pressure, sugar, inflammation, aging, and then what kind of treatments should we start with? And finally, we want to talk about fall prevention. So why write a book about kidney disease? There are a lot of books out there, and other than the AAKP patient plan, there really isn't that much information that's dedicated to patients. And yet 60 million people have diabetes, 100 million have high blood pressure, a third of our population is overweight, and 76.4 million of us are baby boomers, and that's in the United States alone. So given these numbers, it's important, since all of this relates to kidney disease, that we have a book that discusses this, and even as many books as possible. So first of all, a little bit about me. I've been in practice since 1978, so I've seen quite a bit about kidney disease and what's happened with it. I wished I had seen many of my patients sooner. There are so many new concepts now, so many new therapies. The future is very bright with kidney disease. Why isn't there more awareness of kidney disease? Well, first of all, kidney patients don't really feel that bad. We have very poor markers of kidney disease, and kidney disease progression is related to diet and lifestyle. Things like food, salt, lack of exercise, and for some people, still smoking cigarettes. Well, where are the kidneys? First of all, they're located in your back, and they make up these tiny little balls of blood vessels that filter waste products out of the blood. The heart has pumped the blood already to the arteries that feed the kidneys, and then the blood goes into these tiny little balls. They're little filters, and they're made up of capillaries. So this is what one of these balls looks like. And you can see the blood goes in the filter, and it goes in the capillary, and then it winds around, and then it comes back out. Inside the capillary, there's a housekeeping area. We call that the mesangium. There's a capsule that surrounds the outside of the filter, and the blood is filtered across this membrane. And when it's filtered, the good stuff stays inside, and the waste products go outside. Some of the good products go outside and have to be recycled. So if we take the filter and we look at it in terms of the tubules, you'll see there's a long tubule attached to each one of these filter balls. And that's so that we can reclaim the salt and some of the stuff that was thinner that had to be filtered. In other words, the proteins and the red blood cells and many of the minerals stay behind, but some of the smaller minerals are filtered out and have to be reclaimed by this long tube. So just to summarize, blood is pumped from the heart, it's then filtered, it's recycled, and it passes from the kidneys to the bladder. So what are some of the other jobs of the kidneys? Not only do the kidneys filter waste products, but they also filter medications. They stimulate red blood cell formation. They activate vitamin D. They secrete body acids. They secrete potassium. They excrete phosphorus. They balance sodium, and they concentrate and they dilute the urine. It has a lot of responsibility for two tiny organs that sit in our back. So what is a filter? Well, you all know what a filter is. It's what made your coffee this morning. I mean, we all use a filter when we make our cup of coffee. But in the body, the filter keeps the red blood cells on one side, coffee beans on one side of the coffee filter, and all the flavor goes through. But in this case, the minerals and the waste products go through. And so the filter separates big from small particles. That's all it does. Unfortunately, filters are easily damaged, and we can't just throw them away like we do the coffee filters. So what happens? The filter is very easily damaged by high blood pressure. High blood pressure is so damaging that the kidney has to regulate the blood pressure. So it'll tighten or loosen the resistance of that vessel so that not too much pressure can get through. And when parts of the kidney become damaged, the rest takes over and has to compensate. And over time, the regulatory mechanisms break down the kidneys, the filters, and that's when kidney damage develops. So there are many types of kidney disease, but there are only 3 reasons why the kidneys are actually going to fail. The first reason is pressure, high blood pressure. If the pressure is too high, it damages the filter. Number 2, sugar. Sugar damages the filter too. It is very damaging to the filter, in fact. And the third is inflammation. Inflammation, like aging, diet, and most diseases, also damages the filter and all of the surrounding structures that support the filter. And over time, this causes the kidneys to fail. So let's talk about pressure. Well, one of the things that causes pressure is salt. If you have too much salt in your body, the salt intake causes the blood pressure to go up, and the high blood pressure causes the blood vessels to become narrow, and the high blood pressure will damage those glomeruli or kidney filter balls. And the lab test that we use to measure the kidney function is called the glomerular filtration rate. Now, it may not accurately tell us how much damage is taking place in the kidney. It just tells us how the kidney functions. We need biomarkers to really tell us how much damage is taking place in the kidney. But the filtration rate is a pretty good indication of filtration function and how well the kidney works. So we do use it, although crudely. So when did all this stuff start? Oh, about 538 million years ago. Back during the Cambrian era, there were very primitive organisms. And these organisms multiplied. They developed several cells. And in the process of developing multicellular organisms, they developed the ability to do many, many things. And some of these things had to do with how the kidney works today. So the problem is, even though the kidneys developed and the way that the kidneys work developed over millions of years, they never figured out how to adapt to salt. And salt shakers are very modern. Trilobites and clams and dinosaurs are all past history. But salt has only been with us. We've only had access to it for the last 10,000 years. And since our bodies have evolved over millions of years, we never really evolved to be able to handle salt that well. So unlike everything else, high blood pressure is very damaging, but sugar is too. Sugar also releases hormones that tighten blood vessels, and it triggers the housekeeping cells in the filter to release growth factors. So instead of helping, these growth factors cause scar tissue to form. And finally, we want to mention inflammation. Inflammation is our body's response to stress. Now, even though that's important when you're trying to fight an infection, all of those electrons that are flowing damage innocent tissues. The inflammation also causes the release of hormones that can stimulate scar tissue formation. Unfortunately, overeating causes our fat cells to release inflammatory hormones and lower good hormones. One of the good hormones is called adiponectin, that results in too much insulin that doesn't work properly. And this increases sugar, and the inflammation and all the sugar cause the cells in the body to become damaged, not just the kidneys. So aging. Now, believe it or not, the same way the kidneys age is the way the body ages. So let's talk about our friend, the turtle. The Galapagos turtle can live 150 years. They have no predators, and they don't have the kind of lifestyle we do. And because they don't have that lifestyle, they don't have predators, they live a lot longer than we do. They seem to react differently to inflammation than we do. Our main predator is inflammation. Now, the tortoise eats a lot differently than we do. He's a lot more laid back, or she's a lot more laid back than we are. And they have a totally different metabolism than we do. Their mitochondria are probably different too. Birds have different mitochondria than we do. Our mitochondria are leaky. They allow too much oxygen to be wasted, and that leads to too much electrons that are wasted, and that too stimulates inflammation. So the tortoise doesn't have any predators, lives a long time. We have a major predator, and that's inflammation. And that's what shortens our lives. We could go about 120 years, but unfortunately, with diabetes and so many other things, we don't live that long. And we can say that aging is a natural process, but the diseases we have are related to aging more than anything else. The diseases we have usually cause us to age more rapidly. You might not have looked at it that way, but if you do, it will really help you understand the whole philosophy of trying to stay healthy. So, what can we do to protect our kidneys and our whole bodies? Number one, eat healthy and not too much. Number two, avoid excess sugar and keep our diseases, if we're diabetic, under control. Keep our diabetes under control. Number three, control hypertension. Just about every type of kidney disease is associated with hypertension. Manage metabolic acidosis, because acidosis accompanies kidney disease. Take medicines to control angiotensin too, because that can damage the kidneys. Restrict dietary sodium. Avoid smoking cigarettes. Maximize our intake of fruits and vegetables. Moderate our exercise and reduce inflammation and reduce oxidative stress. Acidosis happens because our bodies with kidney disease don't get rid of acids. Now, it's the same thing that happens to coral reefs. Acids weaken calcified structures, and we can fix that by taking either bicarb tablets or eating fruits and vegetables. Fruits and vegetables, believe it or not, are less acidic than animal proteins, and they will help protect us from acidosis. They'll help protect our kidneys. This has actually been shown in the medical literature. The other thing we can do with fruits and vegetables is understand that if we eat more vegetables and more fruit, less plants, we can protect the blood vessels that let the blood flow in and out of our kidneys. In other words, we make the blood vessels tighter that flow into the kidneys. That puts less pressure on the kidney. So it actually helps our kidneys to eat less protein and more fruits and vegetables, and less animal proteins as well. So what are some of those good healthy things we can eat? Well, you're looking at it. Blueberries, raspberries, almonds, sugar substitutes like allulose, Ceylon cinnamon, and turmeric. All of these things are good for us. We should somehow weave them into our diets. What about exercise? Well, muscle wasting and bone loss occur in kidney disease, and balance is the first thing to go. So exercise is critical if we want to stay healthy. What should we do? Walk, pay attention to our core, take our resistance exercises seriously, stretch, and balance. This is all demonstrated in Staying Healthy with Kidney Disease, which is available at Amazon.com. I'm not trying to plug the book, but if you're interested, it is available at Amazon.com. Falls. I'm going to have a whole talk on falls, and it's going to start in a few minutes. But basically, just to summarize, 1/3 of the general population fall each year. It's the second leading cause of unintentional death worldwide. 684,000 people die each year. 37.3 falls require medical attention. And 44% of hemodialysis patients fall every year. I had 3 patients fall in my dialysis clinics just last week. One of them died. Falls occur for many reasons. It's multidisciplinary, so stay tuned for the talk that we're going to have on falls. You'll find it very helpful. It may protect you from falling. Well, we're going to talk more about falls later on, but just a few caveats. Be careful at night. Leave a nightlight on. Use a walker and a cane and a walking stick when you're outside. You're no hero. I use walking sticks when I walk, and I'm in pretty good shape. So there's no shame to taking your walking stick or your cane when you go on a long hike. Review your medications with your provider. Make sure you're not over-medicated. Exercise and take your vitamin D supplement so your bones and muscles will stay strong. Balance exercises are critical because when you get older or you get kidney disease, you lose balance. Keep those cores tight. Keep that belly really, really tight. Consider Tai Chi and make sure your eyesight works. Well, a few other things. Wear a hat when you fall so that when you hit your head, if you do fall, you'll hit the hat, not your head. Carpeting will help you. It's easier to fall on carpet than a hard surface. Make sure you're getting your feet checked. Add grab bars to your showers. Use your handrails. Walk down the stairs and up the stairs for exercise, but always use a handrail. And choose activities that are age appropriate. Use your head, don't hit your head. The CDC has an excellent section on falls, and I've got a book that's coming out next year all about falls, and so stay tuned for that. So just wrapping it up, prevent kidney disease by staying healthy, control acidosis by eating fruits and vegetables, eat a plant-dominant diet, avoid sugary and starchy foods, restrict salt, take antioxidant foods, and supplements carefully and use them to fight inflammation. Things like Ceylon cinnamon, turmeric are actually pretty good for you. Avoid damaging meds like nonsteroidal anti-inflammatory agents. Exercise, don't fall. And we're going to be talking about new drugs such as Jardiance, Farxiga, and Finerenone during this conference. And these too may slow kidney disease progression. I want to thank you very much for listening, and if you have any questions, I will be happy to answer them. Thank you very, very much.
Thank you, Dr. Fadem. As always, an excellent and informative presentation. On behalf of the AAKP, I appreciate you sharing your time and expertise with us.